Welcome to Brainthropology. Let's talk about our amazing brain and the issues that get us stuck. We all have those moments where life gets overwhelming. It can be related to injury or illness, or an issue with your kids, or just because life is crazy and we need a little help and encouragement. Our team of therapists, expert guests, and clients are here to deep dive into the topics that matter most. We will share information with our listeners that encourages, educates, and empowers.
This episode is brought to you by Galaxy Brain and Therapy Center, helping clients live their best lives by implementing strategies such as those discussed in this podcast. Galaxy Brain and Therapy Center is located in Ann Arbor, Michigan, serving southeastern Michigan for in-person and community-based services. Out-of-state virtual and teletherapy services available for OT, PT, speech, mental health, and mindfulness. Check out their website at galaxybraincenter.com.
Hello, everyone. Welcome to the Brainthropology podcast. We have an informative show planned for today. Jessica Smith and I are co-hosting a two-part series over the next few podcasts, and we're talking about a really important topic. We titled the show, I Have a Brain Injury, Now What? So many times our team of therapists, including Jessica and I, get a call saying, my brother was just in an accident and he has a brain injury, now what? Or my sister just called me and her son has a concussion. Or my mother-in-law just had a stroke, what do I do? So we really thought it would be a good idea to share all of the resources that we have for those who either have recently suffered a brain injury or know someone who has and wants to learn more about the next steps. In today's episode, we will be going over the types of specialists that you will most likely come in contact with and some of the basic information about the process of being diagnosed with a brain injury. In part 2, we will discuss some of the immediate personality changes that you might see along with some of the different systems of the body that might be affected. Some of this will be a review. If you've listened to the other episodes of Brainthropology, as a lot of times we will pick one topic and we will be really specific about it. But today we wanted to offer more of a general information session for those who need. And as sometimes when we get a little specific, it can be overwhelming. So hopefully this will just be a general overview to answer that question. But before we get started, we always like to encourage people to start their day with gratitude. And one way that we do that is sharing a personal or professional positive. So Jess, what is your positive today?
We recently had family in town and I had some time off to spend with my family, and my cup was just filled with family time. We did family games. We had kids just running around the house.
That's the best.
It was nonstop family fun. A lot of people would call it overwhelming and chaos. I come from a really large family, and it was just a lot of not planned, just like family time,
That's amazing.
Yeah, a lot of family fun. Debbie, what about your positive for today?
Well, don't laugh at me, but sometimes the simplest things bring us joy and act as a positive. So my positive are comfy pajama pants and Hallmark movies. So yes, they are still playing even after the holidays. Good job, Hallmark. We don't have a sponsor with them, but I really do enjoy their movies. They're kind of no-brainers, and my daughter and I always like to guess the predictable story plots. So that brings me joy.
Yeah, my mom loves those too.
Sometimes it's absolutely ridiculous, but you can watch it and you can talk, and halfway through the movie, you can still know what's going to happen.
Yeah,
so good stuff. All right, so let's get started. As you are listening today, don't feel like you have to take notes, as Meg Scaling, the owner of Galaxy Brain and Therapy Center, has put together a guide called Where to Start: Helpful Tips for Family Members Caring for Someone with a Recent Stroke, Concussion, or Brain Injury. And it's a free printable with all of the information that we're talking about today. And it's on the Galaxy Brain and Therapy website under the printable tools section. So it's galaxybraincenter.com, and then there's a little section on the top that says printable tools. And we will also put it under the show notes here on the podcast. So you'll have that info. So when we get these phone calls from family or friends that they typically feel helpless as they don't know what the next step is after a brain injury, as they're uncertain about how to help or what to do first. So we're doing today's podcast, hopefully, like I said, acting as a first step guide for those who need it. So Jessica, what would you say the first piece of advice would be to a family member or caregiver when we get those phone calls So when they tell us that their loved ones has a brain injury, what do we say?
You know, I like to ask people, do you have the right people on your team? You know, a lot of times people are overwhelmed. They don't know where to start. And I love the company I work for. You know, I've been there. I think I never want another boss. I always joke, like, the people that work alongside me, I can't get better coworkers, a better boss. So obviously I'm a bit biased for Galaxy, but not all therapists are alike. So just make sure you have the right team members. And, you know, I don't want to say, oh, just come to Galaxy, because I don't want people to think like, oh, I just, you know, want everyone to come to Galaxy.
And it might not have, as far as location, it might not be feasible. So
right. But it's true that you have to have people that are passionate about their job and don't just do it for money. I can honestly say that not one therapist at Galaxy just comes in, does their job, and leaves. Every single one of us puts in more time, volunteers our time, and really has a passion for what we do. And those are the type of people you want on your team. Not all therapists and doctors are alike. So you really want to find those ones that specialize, first of all, in brain injury. And, you know, we'll talk about various professionals today and go through those people that make up the rehab team. So we'll, you know, go through what types of doctors, what types of physicians are out there. I suggest also that you get familiar with some of the terms that, you know, we'll talk about today, such as release of information, ROI. You know, we'll talk about a lot of those
three-letter acronyms,
those forms that you'll have to fill out. And why those are important is because there's a term called HIPAA, and you probably have heard of it. Every single doctor you go to has you sign a form, the HIPAA form, and it's about your privacy, right? So no one can just talk about your health information. You have to sign this form saying they'll keep your health information private. However, when you get an injury like this, you want your rehab team to be able to communicate about your progress. And so you sign this release of information form so that your PT can talk to your OT, or your PT can talk to your physician, so that everyone can kind of talk about your progress and communicate for you to have better a continuum of care is kind of what we call it. And so we can communicate and really let your physician know how you're doing. And so you or your loved one doesn't have to kind of be the relay person for all of that health information. It's kind of done behind the scenes for you.
It's so important. Yeah.
And it's really important for that. So
it sounds like you're saying also to be an advocate for yourself and know that just because you were told to go somewhere, you have the option of looking at other places and interviewing people. And I really, that hit home with me because I've had some health issues in the past and I've interviewed a couple different doctors. And when I've told people, they're like, what do you mean you interviewed, a surgeon? And I'm like, no, for real. Like I went to 2 or 3 different people and had a doctor appointment, and, you can look and knowledge is so powerful. So that's really important.
Yeah. People don't realize you can actually choose. Like people think, oh, well, I got a referral to this place. Mm-hmm. Well, that doesn't mean you have to go there. You got a referral for therapy, but it doesn't mean you have to go to that specific place. Right. We do have on that same website Debbie talked about earlier, Galaxy Brain Center, we have a free printable tool that includes a medical binder. We'll also link it to the show notes, and a worksheet that includes medical questions that will help you ask the right questions for various doctor's appointments as well. So you can check that out, and that also helps for the team communication as well. Debbie, can you talk about a few key team members that you'll likely encounter on this journey?
Sure. I think probably one of the most important people on your team is your PM&R physician. So for the longest time, I didn't know what PM&R meant until I became an OT, and it actually stands for Physical Medicine and Rehabilitation Physician. So this can be an MD or a DO, and this person will be in charge of prescribing therapies, and they really have a good idea of what facilities will serve you really the best in your area. So if you're going to if you live in Ann Arbor, if you live in Brighton, trying to find some place that's near you that has a reputable PM&R doctor, because they will be familiar with the people in your area.
Just also to mention another term, just because I think the medical world likes to confuse us sometimes, a physiatrist is also a PM&R doctor. Same thing, physiatrist, PM&R, but if you hear that term,
that's really good to know. So a PM&R physician or a physiatrist, they really understand the recovery process, and they understand that it takes time, and they will suggest external providers to get involved that are necessary. So visits typically are once a month initially, and then as the recovery process goes along, it goes down to every 3 months. During the rehabilitation process, this really is one of the most important doctors that are going to facilitate your care. So be picky. Ask around in the field. If you get a case manager, which we're going to talk about what that is, you can ask them, if they've had any positive experiences, or you can go online and look at reviews. So it's really important to be picky during the process of choosing the best one. The other two important doctors that I think we should talk about are a neurologist and a neuropsychologist. So Jess, can you tell us the difference between the two? Because it is a little confusing.
Yes, it definitely gets confusing. So a neurologist has gone to medical school, and a neuropsychologist has a PhD. So a neurologist is essential for identifying the nature of injury and performing and interpreting diagnostic assessments, as well as performing necessary brain surgeries. The neurologist will explain where the injury happened and what symptoms and implications, as well as the type of injury. And some neurologists may function similar to a PM&R, depending on the way the practice is set up. They may prescribe therapies, additional services and tests. Other times, the neurologist is active initially in the acute phase, meaning after the injury initially happened. And then they may phase out and be available in the background in case you need them. And you really may only see them annually. As you progress through rehab, you likely will probably see them less often and see your physical medicine and rehab doctor a little more. A neuropsychologist is really essential for so many reasons. They test cognitive functioning as well as emotional well-being. A good neuropsychologist will not only tell you the areas of the brain that are impaired, but they will also highlight areas that are strong. Understanding and building on strengths is just as important as understanding the deficits and impairments, especially for therapists. One of the things I love is going to a review of a neuropsych testing. And so these cognitive tests that neuropsychologists do are also called neuropsych testings. That's what the shortened version is.
Yeah, like we'll get a message saying your client has had a neuropsych test and these are the results. And it's so powerful because in therapy, it actually can save us time. So if we go to one of these presentations and it shows you that a client is a verbal learner or an auditory learner, then we know that, okay, if they're visual, then we can color code things and we can, do different sticky notes places because they learn visually. It saves us a lot of time in therapy.
Yeah. So when it says, they'll highlight the areas that are strong and then also tell you their impairments. It really does help you to understand what strategies that you can use as a therapist. So it's really, really beneficial as an occupational therapist, and really speech therapy. Anyone can kind of benefit from these reading your client's test results. The test results can also help you understand if someone can be left alone, how much supervision they may need, if they're able to return to work. Do understand that these tests can be done in what's called an IME, so an independent medical examination.
You don't like that word.
Right.
As a therapist, we don't like that word.
So what that means is the insurance company has requested that. So that's typically, the insurance company is looking to, cut off services. And so they may...
Or decrease.
Yeah, or decrease services. And unfortunately, a lot of times what happens is, the neuropsychologist may not be given a lot of paperwork and they're not given a lot of time to review things. And so they don't have a full understanding on the client, and they may not see all the deficits. And
that actually brings up a good point, Jessica, is if you are getting an IME, to let your team know, because your team can give information and send reports that aren't necessarily requested. So we can actually provide very important information because we see the client 2 or 3 times a week. So instead of just getting that one report for the neuropsychologist that they've seen once, that is another tidbit that is probably important to know.
Yeah. And not all insurance companies are bad, but, IMEs are definitely not necessarily a good thing. And so you just want to be cognizant of that and let your team know that's happening.
For sure.
I also ask the neuropsychologist typically if they have anyone that does weekly therapy, because if so, they are probably in the business of helping people. So just make sure, to do your research and find someone that does neuropsych testing and is not just doing those IMEs. You want to make sure that they are fighting for the clients and not just, doing testing for insurance companies. So
that's great information.
Yeah.
Another important person that you want to make sure is on your team is a psychotherapist, a PhD or an MSW. So some people refer to a psychotherapist as a counselor. That's probably more people are more familiar with. So a psychotherapist is really essential to have on your team because brain injury changes people. So many times they know it and they don't necessarily like the new version of themselves. We hear this time and time again with clients, but they don't know what to do about it. And many times clients don't know what's best for them and they act very reflexively without thinking things through. So you might find that the person that has the brain injury has a shorter fuse and they might blow up quicker when they're in discussions with you, or they might be really moody, or they might have been moody before their accident and the accident actually exacerbated it. So exacerbated is another term just to make things a little worse. It has made it worse over time. So they may have had a complete personality change and go from a super kind, relaxed person who never swore to somebody who uses profanity and treats people really poorly. And it's important to know that that's the brain injury. That's not the person themselves. So a psychotherapist will use many different therapeutic approaches depending on the needs of the client. And if there's a history of trauma for the individual, this can also sometimes creep back into the picture and needs to be addressed again, or maybe for the first time if it wasn't before, if it was kind of hidden. It's very important to address that. So keep in mind that a psychotherapist can also help address caregiver burnout. And this is so important. We see this very frequently in many times and when we're doing therapy. If you're a caregiver for someone, you will quickly realize that you need support too. So a counselor can help make a behavior plan if necessary and will often set up a plan and structure for what to do when these negative behaviors happen so that everyone is consistent with the behavior response. So you want to make sure that the therapist you're working with really does, again, what Jessica said before, specialize in brain injury. There's nothing worse than paying for psychotherapy or counseling and spending the whole session teaching the psychotherapists about the idiosyncrasies of brain injury. They really need to be therapists that specialize in that subject in brain injury. Now, because of teletherapy, you can likely find an expert, and it might not have to be in your state. Michigan has some really incredible ones because we've had the luxury of no-fault auto, so a lot of research and specialization does happen in Michigan. So you probably are asking, what's a behavior plan? I kind of threw that word in there. Behavior plans are really important, and Jessica and I have worked with many of them in occupational therapy, and physical therapists have worked with them, speech therapists. An example would be, I had a client that had a behavior plan. It was implemented when the client had outbursts and they yelled and they were swearing at the therapist and their family members. And when that happens, you need to have a consistent response in order for that negative behavior to decrease. So the behavior plan helped the family and me as the therapist respond consistently. And no joke, over 2 or 3 weeks, the outburst decreased significantly and we were able to move forward more quickly in therapy. So
great. Good example.
Yeah. So we can't forget to talk about a very important part of recovery. That will be the different types of therapists. So that's kind of where Jess and I, our specialty is as far as occupational therapy. But can you give us kind of an overview, Jessica, of the different type of rehabilitation specialists that you might come into contact once you have a brain injury?
Yeah, so there's physical therapists, occupational therapist, and speech and language pathologist. So if you or a loved one has a neurological injury, you need to get on finding a neurological clinic to help. The one closest to your house is likely not the right fit. It might be convenient because it's right down the street, but most clinics that only offer PT are orthopedic clinics. They use what's called a biomechanical approach, and they can have up to 3 or 4 people on their schedule at the same time. They typically focus on strength, range of motion, and mobility for the most part.
And I want to emphasize that it's okay to have 3 or 4 people on your team for an orthopedic clinic. What we're talking about is neuro. So when we were talking about the behaviors, if you have somebody that has negative outbursts or needs more time because of the vestibular issues, you really need that one-on-one. So we're not saying it's not appropriate to have 3 or 4 people, in an orthopedic clinic. That is a typical, to have that on your schedule. But with neuro, it is different.
Right. So with a neurological rehab, there's a lot more at play. There's a lot of safety risks likely because of a vestibular issue. And so the person may have, issues walking and may not be as safe with mobility. And so you really need that one-on-one approach. And so biomechanical therapy, it's, there's a lot of machine use. And in terms of brain rehab, it's really important to have people doing, therapists doing one-on-one and doing that therapy, making the body move. If you find a clinic that offers all 3 disciplines, PT, OT, and speech therapy, you'll be in good shape because they understand there's more to rehab than just physically moving. So the world requires you to do so much more. If all of the therapy that your loved one has to do is home care, then that's not enough. They need to get out into the world. They need to be doing, things that they'll do in the natural setting of going out into the community. Home care, just so you know, is a paid per visit. So if that therapist comes in, they get paid the same to be there for 15 minutes as they do to be there for 60 minutes. So sometimes they're not there very long. And they really focus on safety in the home, but not necessarily outside the home, because the reason for home care is they're considered homebound. And so their main priority is making sure they're safe in the home. But once they're beyond that, they really need to be in outpatient care. And so you want them to be in outpatient neurological care.
And there are therapists that will come into the home for community therapy, and that is not the same as necessarily home care.
Yes.
So home care is kind of a beast in itself. So important to know that it's kind of a different category. It can be very important to have your home care visits, but this is a different part of the therapeutic process.
Yeah. So in terms of neurological clinics, you're typically seeing the whole person approach.
Yeah, it's very holistic.
Yeah.
I want to tell you too, for having 3 disciplines in one place, it's so convenient. As something people don't always think about is so many times that the person with a brain injury, they actually need transportation because many times they can't drive. So it's a lot easier to get one ride to and from a place during a day instead of 2 rides for 3 different disciplines, so 6 different rides. So that's something to take into consideration as well.
Yeah.
So after looking, it's really important that we talk about the different systems with brain injury. We want to make sure that the 4 different systems we have are being addressed in therapy. So we've talked about this on other podcasts, and we will put links at the bottom of in the show notes today, because we probably have 3 or 4 different podcasts that really break down each of these systems. But today, again, we wanted to give a general overview. So if somebody has had a brain injury, they can have a quick overview with the terms and what we're talking about. So the 4 different systems that you want to make sure are addressed in therapy are cognitive, physical, sensory, and emotional. And under cognitive, the things that we would work on as a therapist are memory, problem solving, focus, alternating attention. Under the physical system, so a physical therapist would work on, is pain, mobility, balance, coordination, vision, reflexes. And under that would be the reflex integration. And we actually have a whole, we talked about this topic in several other podcasts. The sensory system. So after a brain injury, you will find that there are a lot of sensitivities that arise. So sensitivities to lights, sounds, smells, touch, and crowds. And then the emotional component. So the social worker or the counselor that we talked about, emotional needs. So your mood, depression, anxiety, PTSD, and addiction. So all very important. So other therapies that you might not think of once things are a little more stable in your rehab process are music therapy and recreational therapy. They can be extremely beneficial. So not all insurance companies pay for this service, but it's definitely worth looking into. It's so important for people to regain quality of life through meaningful and purposeful activities. So as people progress through therapies, vocational rehab counselors are also very helpful. So getting people back into the workforce or doing something that's productive for them, in transitioning people to get gainful employment. So,
definitely.
Yeah. So, gosh, what other specialists should we mention, Jessica?
Well, let's see. There's psychiatrists. So they prescribe medications for mood, behaviors, and mental health, as well as pain management. Brain injury changes the way that our brain functions and even our pituitary functioning, where our hormones are produced. So endocrinologists, neuroendocrinology. So neuroendocrinology is different from even psychiatrists. So those are becoming more popular. There's more research out there saying people with brain injury should get to neuroendocrinology. So I have a lot of my clients lately seeing endocrinologists. And so there's also attendant care that are either medical or non-medical attendant care aides, and they can be very helpful for keeping people safe at home. And it's important for caregivers to get some time to themselves. And so attendant care is typically an out-of-pocket expense that costs an average of $25 to $33 an hour if you use an agency. And again, it's not typically covered by a typical insurance company. And some people choose to hire family and friends for around $15 to $20 an hour, but remember that they are not insured. And so if they are injured on the job caring for your loved one, you ultimately could be liable. So look for companies in your area that are willing to work just a couple hours at a time. Some have a minimum of 8-hour shifts, which is hard and can get really expensive, but it can take some calling around. You will find one that works for you though. And again, it can be beneficial if you're a caregiver just to find an agency that can give you some relief. And I know it seems expensive, $25 to $33 an hour, but again, if you have that liability piece if you use an agency, where if you're paying someone out of pocket, you don't have that insurance.
Yeah, that's so important. And that can help prevent that burnout, that caregiver burnout.
Yeah.
Yeah, that people really don't consider. And it's so important.
Yeah.
So some other important specialists that I thought of to familiarize yourself with are neuro-ophthalmologists and neuro-optometrists. This is another confusing one. And it's important to know the difference. So a neuro-ophthalmologist is an MD, and a neuro-optometrist are both people that you might see on your recovery journey. Oftentimes after a brain injury, there are significant visual changes. And as I mentioned before, I think we have a whole podcast on that. I believe Dr. Carter was one of our special guests. Yes. So when someone hits the back of their head where the vision center is, and they have whiplash, or there's a brain bleed that affects the visual center of the brain, then there are often visual changes. So vestibular problems and balance can also contribute to visual deficits that people don't realize. These doctors can help determine the course of treatment or surgery or vision rehab or the need for prism glasses. So what's the difference? So a neuro-ophthalmologist can help diagnose visual impairments resulting from brain injury, and a neuro-optometrist help prescribe special glasses called prism glasses, or they'll prescribe vision therapy exercises to help the disorder. So those two are very important to go see at least once to make sure there aren't any issues, and then they can determine if there's been any damage in those areas. Another specialist we forgot to mention is a medical nurse case manager, which I think is so important. At least in our specialty, we work with them almost all the time, and they are such valuable members of the team. Just, can you tell us how important medical case managers are and what their role is?
Yes. So if your loved one lives in Michigan and was in an auto accident, there's a good chance your insurance company assigned you a medical case manager. If not, they likely will, but you actually have the legal right to choose your own case manager. I recommend that you interview them. There are case manager associations that can help guide you and direct you. The case manager is a liaison between you and your insurance company. So they will help you choose the correct service providers, from doctors to therapists. In most medical, so non-auto or workman's comp related injuries, case management, unfortunately, is not a covered service. If it is a covered service, they arrange transportation, again, make those doctor's appointments. They're advocates. They go to the doctor's appointments, they're another ear to listen in on the doctor's appointments and help to understand what the doctor's saying, and again, advocate. Make sure you get the prescriptions written correctly that you need for therapies or even medications. You may be able to pay privately if you think that this is a service that would be helpful for you or your loved one. And the nurse case manager that you hire could go to appointments, help organize treatment. It typically could cost between $125 and $150 per hour. And I would like to point out that there could be case managers that are social workers, occupational therapists, or other professionals, health professionals as well. Nurse case managers are the most common, and I want to stress the importance of interviewing them for their skill set as well as their personality to make sure that it's a fit for you and your family member. Just remember, they're going to be going to these appointments with you, and you want to make sure that they fit in with you, your loved one, your family. So make sure you do those interviews. And if your family has been assigned one from your insurance company, again, remember that you have the legal right to choose.
Yeah, absolutely. And I think it's important too to know that they specialize in traumatic brain injury.
Yeah.
Which a lot of people will just take whoever, is assigned to them. So that's great information. That is a lot of information about the different specialists that you might encounter on this journey. Keep in mind that you may only need a few of the types of specialists that we mentioned. We just wanted to make sure that you're familiar with the potential team that you might be working with to prepare you. Because as I said before, knowledge really is power. And that's the purpose of this podcast. I think the last thing that we want to make sure we mention today is how important getting support is to help the process. Because what has happened to you or your loved one, it's important to respect that once you have a brain injury, you typically don't act like you did before the injury. They really do, brain injuries really do change people, and it's sad but true. And sometimes there are positives to a brain injury. I mean, several of the clients that I have after their brain injury, they became so creative, and they are amazing artists, and they didn't even dabble in art at all before their injury. So there are positives as well. I'm just saying typically there are changes and the person is a different person. One example would be those who suffer from frontal lobe damage, suffer from impaired executive functioning skills. They have decreased insight, poor judgment, poor problem solving, and many times have difficulty with functional memory. And again, we have a whole episode on these different things, so this is just an overview. But depending on the part of the brain that were injured or affected, their deficits can be balance related, mobility or movement related, or it can affect speech or both expressive, within speech, both expressive and receptive, and personality and mood. So understanding where the brain injury happened will help you understand why your loved one might be having particular symptoms. So really take time to listen to what the brain injured person says. Each brain injury is unique. So you really need to learn about your loved one and why they feel, how they process and think and observe the different changes that they're having. Don't ignore certain things that happen or suicidal ideations they may have. Get them to talk about it. The brain injured person, they need to know you care, and they need to trust the professionals that are helping them. Many times we have, many of our clients have said that they feel like they almost feel like a fraction of their former self, and it's just heartbreaking, and they really need people to navigate through that, and they need all the support they can get from experts that know how to motivate and progress them. There's other things that can help as well, like support groups.
Yeah. You need to know that you're not alone. Brain injuries do not discriminate. They don't care how successful someone was, how much potential someone had. They surprise us when we least expect it. They take away parents, grandparents, spouses, children from their typical roles in the family. They often turn the entire family network upside down. It's important that you find people who will listen and understand. The Brain Injury Association of America has support groups all over the United States. The Michigan chapter has a lot of resources available on their website.
And we'll put some links too in the show notes.
Yeah, the Cleveland Clinic put out a great resource on the 6 pillars of brain health that are very helpful for everyone, especially those with brain injuries. At Galaxy, we offer free Love Your Brain yoga that starts at various times throughout the year that can be done in person or virtually, and it includes a 6-week discussion on resilience. You can join us from wherever you are. Seated and standing classes are offered. Take time to really learn about brain injury. We will put links in our show notes on all of these resources. The bottom line is find your people and make sure that you have support to help you get through all of this. It's overwhelming and you just need support.
Absolutely. That's a lot of information. Well, thanks for joining us for part 1 in our 2-part series. I have a brain injury, now what? In part 2, we're going to be discussing some of the immediate personality changes that you might see with a brain injury, along with the different systems of the body that might be affected. So please see the show notes for some great links and resources about today's topic. If you found it helpful or think any of your friends or family would benefit from hearing it, please share this episode. Feel free to check out other episodes at brainthropology.com. And as always, we encourage you to be courageous and move forward in your day with hope, joy, and purpose.
While we love what we do and are as passionate as they come, the information on this podcast and discussion is for educational purposes only and should not replace professional medical advice. Please consult your own healthcare provider if you are seeking medical advice, diagnoses, or treatment for you or anyone else. We do our very best to provide correct information, but please understand science and medicine is ever changing. We welcome feedback, comments, suggestions, or correction of errors. This disclaimer applies to any guest or contributors to the podcast or blog.